We're going to talk about something that is a massive life or death misunderstanding. We're talking about heart attacks, but not the ones you see in the movies. We're talking about how they really happen in women.
So let me just ask you, right off the bat, if you were having a heart attack right this second, would you actually know it? The scary thing is, for so many women, the answer is no, and we're about to find out exactly why.
To really understand this, I want to start with a story. It's a story that kind of perfectly lays out the problem, and it's going to challenge pretty much everything you think you know about heart attacks.
Okay, so picture this. A 43-year-old mom, super busy, probably juggling a million things. She just feels off. She's tired, a little nauseous, and has these weird aches. So what do you think? The flu, right? Or maybe just stress. That's exactly what she thought.
But here's the thing. Notice what wasn't there. None of those classic signs we've all been taught to look for. No crushing chest pain, no pain shooting down her arm. And because she wasn't feeling what she expected to feel, she just went to bed, figured she'd sleep it off. And this is the devastating result. For hours, she was having a major heart attack, all while her brain was telling her it was anything but. And this story, it's not some one in a million thing. It's a terrifyingly common reality for women.
So why? How does this keep happening? Well, this isn't just about us not knowing the signs. The real problem is way bigger. It's this huge blind spot that's been built right into medicine itself.
I mean, just let this sink in. Heart disease is the #1 killer of women. It takes more lives than all forms of cancer combined. And yet, when you think heart attack, you almost always picture a man, right? Clutching his chest. That massive disconnect, it's lethal. And if you want to know where this all started, you have to look back. For decades, from the 50s all the way through the 80s, the big important heart studies were done almost entirely on men. It wasn't until the early 90s that anyone officially said, hey, maybe we should include women in these studies. But by then, so much damage was already done. The very definition of a heart attack that doctors learned was really the male definition.
And this is the result. This comes straight from a cardiologist. Doctors who were trained on all that old data were literally missing the diagnosis over and over again. They were looking for one thing, while their female patients were describing something totally different.
Okay, so if the classic Hollywood heart attack symptoms are wrong for women, then what are the right ones? This right here is the information that can literally save your life or the life of someone you love.
These are the 5 big ones for women, and you'll notice they sound pretty ordinary, don't they? Crushing fatigue, not just being a little tired. Suddenly being short of breath, nausea, aches in your back, your shoulders, even your jaw, and breaking out in a cold sweat for no reason. Any one of these could be your body whispering that something is seriously wrong.
And let's be clear about that fatigue. It's not just, I need a cup of coffee tired. This quote from a survivor, it just says it all. It's a kind of deep, overwhelming exhaustion that hits you out of nowhere. Simple things like washing your hair feel impossible. That's your body basically shutting down because your heart is in trouble. So here it is, side by side. On one side, you have the myth, the movie heart attack, and on the other, you have the reality for so many women. And please pay attention to that last point. For women, the symptoms can come and go. That is so dangerous because you might start to feel better and think, oh, okay, it was nothing, when it's absolutely not nothing.
So what's the real cost of all this confusion? 37 minutes. That's how much longer, on average, women wait before calling 911 compared to men. And with a heart attack, every single second matters. 37 minutes. That can easily be the difference between a full recovery and permanent damage, or worse.
And don't for a second think this is just about being unhealthy or out of shape. Look at this story. A marathon runner, super fit. She felt tired and short of breath and just blew it off as, maybe she overtrained. She was so used to pushing through discomfort that she actually ran a race while her heart was failing. It just goes to show how easy it is to miss these signs, even in the healthiest people.
Okay, so we know the history, we know the real symptoms. Now let's get to the most important part, what you can actually do about it. This is your action plan.
A lot of the time, it's not about one single symptom, it's about the combination. So think, that extreme fatigue plus shortness of breath, or that back pain that comes with a cold sweat. And this is so important. Trust your gut. If you have that feeling that something is just deeply wrong, listen to it, especially if you already have risk factors.
So if you ever think this is happening to you, these 3 steps are absolutely non-negotiable. First, Call 911 right away. Don't drive yourself, don't wait. Second, use the words. Say, I think I'm having a heart attack. Don't downplay it. And third, you have to be your own advocate. At the hospital, demand an EKG and a cardiac enzymes check. You have every right to be taken seriously.
And that brings us right back to that 43-year-old mom from the beginning. She did survive. And what she said is really the heart of this entire explainer. This isn't just trivia. This is life-saving information that for way too long, most of us just didn't have. So, we'll leave you with this thought. For women, a heart attack often doesn't scream. It whispers. It whispers with things like fatigue and nausea and weird little aches. The question is, after hearing all this, are you ready to listen? But you know, just surviving the heart attack itself, that's only the first hurdle. Join us next time, because we're going to dive into what happens after a woman leaves the hospital. The disparities in care and rehab are shocking, and they are costing lives. You're not going to want to miss it. Thanks for tuning in.